You mentioned subclinical hypothyroidism, someone in this area. Big deal. I mean, if you have normal labs for thyroid, but you're miserable and you're fatigued, we've got to check out and see if maybe you mentioned cytomel, maybe a mixture of T4 and T3 together will help get rid of the syndrome, and it works like magic for a lot of people to do that. And these are what we call the chronic pain areas that Dr. Kelber and I work in quite a bit. So, this is rheumatoid arthritis, lupus, back neck joint pain, herniated disc, spondylolisthesis. Anyone know what that is? It's when one vertebrae slips over another. That can be very painful and cause pain down the legs, or if it's in the neck, can cause pain down the arms. Spinal stenosis, that's mainly a disease of aging where the spinal cord becomes crimped by the bones that start to overgrow with degenerative arthritis. Scoliosis, we see this almost every day in our clinic, and when it's severe enough, it can look like fibromyalgia because people just get wiped out from the pain they have. Muscle imbalance, which Dr. Kelberman works on quite a bit. Poor posture, which he works on. Ankylosing spondylitis, which is associated with a genetic pattern where the sacroiliac joints start to fuse. That gives an awful lot of fatigue to people when they have that. It's a real drainer. Lax ligaments, that's something that I work with quite a bit with doing prolotherapy. We strengthen the ligaments, we build them up, and people get better that way. So people can have this type of syndrome, whiplash. When people have a whiplash, which is an acceleration-deceleration injury where the head goes back and forward, they get a whole list of things that can come up. They can have TMJ that comes from that. They can increase the sympathetic outlay in their system, and they can have all kinds of syndromes, stomach pain, and other things that look like fibromyalgia. So what is chronic pain? Because we deal quite a bit of that in our practice. Very simple. Pain that persists longer than the temporal course of natural healing, which is usually about 2 to 3 months. So people come into my office every day and go, I'm in acute pain. And I say, how long has it been going on? They say, oh, I've had it for 10 years. Well, that's not acute. Acute means new pain. It doesn't mean bad pain. Chronic means longer than 2 or 3 months. Acute pain means new pain within the first 2 to 3 months. The severity of it is something else. What does the International Association for Study of Pain define it as? Pain as an unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage. So sensory and emotional experience, what does that mean? Many people have pain in their body because they somaticize their emotions. And that's a big part of what fibromyalgia can be also. That means if a person doesn't like to deal with their emotions, maybe men more than women, I'm not sure, then what they'll do often is they'll somaticize it. They'll take it into their body and create a pain for themselves unconsciously, and they talk about their pain. It's cool to have pain in an elbow. It's not cool to have emotional problems in our society. That's looked down upon. And there is actually a test that can show if you're a somaticizer. It's called the Minnesota Multiphasic Personality Inventory, or the MMPI. If anyone in this room or has a friend that's going to get surgery, back surgery, neck surgery, please have them to take that test first, because there are certain people that will not heal from surgery because they're still going to somaticize the emotional issues they have. The surgeon will do a perfect job on the anatomy, but the patient will still have pain. It may go somewhere else. I've seen patients who have sciatica on the right side. They come back to the office after we tell them not to have surgery when they go to do it anyway. Now they're standing like this, and the pain's now down the left side. And then they go back for another surgery, do a fusion after a laminectomy. What happens? Now the pain's all over. Those people are not going to get better. And the studies do show if you fail one surgery, failed back syndrome, the next one's not going to do you very much good. Anyone here have back surgery so far? You have. How many of you had?
4.
4. How are you doing today?
Well, I'm trying to psychologically put things into perspective.
Thank you very much. You don't have to say anything more, because what we hear between your words is you're not very happy with the outcome. Although you might be better than you were, it didn't do what you thought it would do. And I bet if you stick with surgeons long enough, they'll do a 5th surgery.
No more surgery.
I know you're not going to do any more. But my point is this. I don't believe in surgery. Dr. Kelberman doesn't believe in surgery in probably 99.99% of the cases. Surgery is great if someone has a progressive neurological deficit, meaning that there's something that's moving on very quickly, their leg is dying. Yeah, go to the surgeon. I'm not going to get in the way of that. But the elective procedures, I am totally against, and I think Dr. Kelberman is against. So what diagnostics do we use? Labs, of course, blood for most things. We use saliva for cortisol, because if the adrenal glands are not producing enough cortisol, we're not going to have any energy. Cortisol is a hormone, is a stress hormone that mobilizes sugar from our muscle and from our liver. So when we wake up in the morning, it's on the high side to give us energy to go for our day. As the day goes on, there's a nice circadian rhythm where by the time we go to sleep, it's very low and we're relaxed. What do we see when we do an adrenal saliva test very often in Los Angeles? We'll either see someone who's way up here where they're running fast, especially people in the entertainment industry, the financial industry, things like that, real estate industry where people are very, very stressed. And what that means is their adrenal glands are pumping too hard. They're pumping out a lot of cortisol to support that person's level of activity. What happens, do you think, when we see someone way up here? What happens the next few months? What happens to adrenal glands? They poop out. They poop out, they go into what we call adrenal fatigue. And then they wake up in the morning, their cortisol is down here at the bottom, and then it just sometimes flatlines all day and they're miserable. Is that something we can assist? Absolutely. There are supplements, there are herbs that can stimulate the adrenal glands to produce more cortisol naturally. And then if a person's in real trouble with it, I've had one person so far that was in adrenal crisis. I sent him to the hospital, I pumped him full of cortisol. And there's a lot of people that take cortisol. We give cortisol to people, natural hydrocortisone, at a very low dose. So we do saliva test for cortisol. Blood spot is just poking your finger like people do for diabetes, and then squeezing out a little blood on a card and then sending it to the laboratory. It's a very convenient way to check certain things in your blood. One thing we can do that for is the arachidonic acid over EPA ratio. Arachidonic acid, which is very high in things like red meat, metabolizes into what are called prostaglandins, which are inflammatory in nature. Now, it's not just in red meat that we have it. We have it in all the bad oils that we eat. And the EPA is something that's found in fish oil, with omega-3s in fish oil. And it is anti-inflammatory, okay? So in our country, we find an average, would you say about 20 to 1 in our country, 20 or 30 to 1?
40 to 60, I mean, yeah.
It's very, very high arachidonic acid in our body compared to the amount of the omega-3s or the anti-inflammatories. What does that mean? Most people in our country run at a very high inflammation level. What does that mean? Most diseases, including heart disease, cancer, come from high inflammation in the body. So this is a test that can be done to see how many more tablets or capsules of fish oil you need to take a day. And I would bet anyone in this room has a very high ratio. Other countries don't have it. The poorer countries don't have this. You know, the countries that are eating a lot of fish and have more pure food. Urine is very good for some things to check out what's coming out of your body. Stool sample, very important for this. Because if we find a bug and we can kill the bug, you know, naturally, or sometimes antibiotics are needed. If someone has cryptosporidium, they need a pretty powerful antibiotic to get rid of it. You can use different herbs, but the chances of getting rid of it is very tough.
When you say bug, does that include parasites?
Parasites. Crypto is a parasite, actually, yeah. So we also have to be very careful when we have some of these syndromes to really check physically what's going on. Because sometimes it has nothing to do with all of these subtleties that alternative medicine teaches. It may just be totally musculoskeletal. So we do a very thorough physical examination. X-rays are important. MRIs are important. CT scans are important. Mandatory labs, these are my mandatory labs, what I do. You're going to see an awful lot coming up here. I'm not going to discuss all of them with you, but I will some. Iron deficiency, what happens? Anemia, what happens when you're anemic? There's not enough oxygen to go around to the body.